Hi, I'm Craig Coggle and welcome to my vlog, Skills versus Capacities for St Mary's University. First up we have Gemma. Gemma is a competitive powerlifter entering her off-season. We are going to highlight a skill issue with her high bar squat technique. As we can see from this overhead squat assessment, Gemma has a slightly raised right shoulder and shifts her weight to the right slightly. As well as turning her right foot out, this is due to an injury sustained during her competitive season, and we are still working through her rehabilitation plan to correct this. From the side, you can see that she has an aggressive forward lean, but for this assessment she achieves good depth. From the rear, you can see the right side is elevated and that her arms drop away from her slightly. Lower down, when we look at her legs, she is good, and her left ankle has a slight overpronation in her left foot. She has good hip flexion, and dorsiflexion is good and sufficient for squatting. So as we can see, hip flexion and ankle flexion would not be an issue for this movement. If we move into the hips now, we can see her internal and external hip mobility is good also. So as we move into the squat assessment, in this squat we will be able to see that she shows good depth without any issues, but the bar is slightly lower on her right side due to injury. From the front view, the squat looks good. However, when we look from the side view, we can see that Gemma shifts her weight from her midfoot to her forefoot, causing the bar to move in front of her central mass. This can be seen when tracking her bar path. From testing, we can see that Gemma has the capacity to perform the back squat to the ideal technical model. However, she needs to work to improve her drive through her midfoot, keeping the bar path straight. In order to address this skill breakdown, we have programmed unilateral work with an emphasis on midfoot drive, such as weighted lunges, curtsies off a box, and to activate the glute medius. This, together with the general mobility work during her general preparation phase, should see improvements in squat technique. Next we have Mike Engelkamp, also a competitive powerlifter with low bar back squat. For Mike, we are going to demonstrate some capacity issues. As you can see, he has a very good squat technique, achieving good depth with good control. The bar path stays over his midfoot, but he appears to be very posteriorly chain orientated, with little glute activation and relying heavily on the hamstrings and the back. From this side view, you can see that he puts a lot of the strain into his back before letting his knees bend in. Here is his bar path, which is nice and tight, keeping the weight over his midfoot. From the rear, he appears to go slightly lordotic, and then there is a butt wink at the bottom of the squat. In this overhead squat assessment, from the front you can see straight away that there is an aggressive forward lean, meaning he's very hip dominant, and there is a weakness in the glutes. His feet are turned out and he's not comfortable in this position at all. From the side you can see that aggressive forward lean where the hips are being dominated in the movement, and an aggressive lordotic posture going into a kyphotic posture at the bottom of the squat, indicating some posterior chain tightness and an anterior pelvic tilt. His arms fall forwards away from him, indicating some tight pectorals and upper body mobility needed also. So as we test his posterior chain, we can see that there's very limited range of movement, where the hamstrings and the glutes are not allowing much forward flexion. His hip mobility is good, so there's no issues with getting the hip range. His internal and external rotation of the hips is an issue, as you can see in this drill, which will also double up as a mobility exercise. He struggles to find the internal and external rotation through his hips. During Mike's general preparation phase, we have given him lots of hip mobilization, some piriformis and some glutes stretches to try and get those hips open and getting the back nice and balanced, getting some flexibility into his posterior chain. and also trying to work on some upper body mobility, opening that chest to balance up the upper back and the chest imbalances. The capacity issues that Mike faces are the imbalances and the lack of muscle activation within using the glutes to help drive out of the squat. So hopefully with this intervention we should see a great improvement on his numbers. As you can see, this has already started to tighten up his bar path. Tom Hackett with the snatch and a skill issue. Let's look at his snatch from a few different angles. He has very good technique, but seems to be very unstable in the catch, and as you can see, he travels forward slightly in order to catch the bar. He's got very good ankle flexibility, and he has no issues in finding depth or the catch position. Slightly soft through the shoulders, and he appears to take his weight into his forefoot. From the side we can see that he drives out forwards instead of coming straight up out of the base. So we are trying to do some upper back stability work, and we are trying to do some drop landings to get him finding the midfoot instead of the forefoot when he receives the bar. During warm-ups and drills he has no issue in landing in his forefoot, so it's an issue when the bar comes into play. And we identify that during the second pull, as the bar travels up towards the chest, he throws his elbows backwards and brings the bar away from him, making him unstable and kicking the bar forward slightly. We have got him doing some drills from the second pull, shrugging the bar up through his shoulders, keeping his arms straight, trying to emphasize that pull through the shoulders before you let the elbows float. Moving on from this drill, we started to let him to float his elbows, keep that bar nice and close to his body, making sure the elbows stayed above the bar. And when you find the right position, to drop under and receive the bar. Not perfect yet, but repeating these drills should get the result we want. Rebecca Coggle, sumo deadlift and a capacity issue. From the front we can see she has a slightly valgus knee, and from the side she gets her shoulders over the bar, but could do with dropping her hips into the movement further. From the back you can see that her knees are rotated inwards a lot more than we would like. From the side we can also see that her upper back is slightly kyphotic with her shoulders rounded forwards. Moving into the overhead squat assessment, we can see that she really struggles to get to any sort of depth. Her toes are turning out, her knees are driving out, using the glutes efficiently. There's a little bit of a wobble through the legs. From the side we can see there appears to be a limited range of movement through the ankles. Depth is very limited and the arms are falling forwards. The upper back gives way slightly, and moving down into the lower body we can see it just looks very restricted for range of movement. And coming down to the ankles look fine from the rear. So carrying these tests on, let's have a deeper look at the ankle mobility. The ankles are tight, but there seems to be sufficient range. In the hips we found them to be very tight, having to lay her down to get internal and external rotation. So we have prescribed some hip flexor mobility, some hamstring mobility, and some sartorius stretching to try and loosen up all of that hip flexor joint. In the upper body we need to release pec minor and pec major, just to try and stop that forward pull from the chest. As an auxiliary exercise I've given bar slides with the aim to try and learn how to control the movement, learning to sit down into the bottom position, which would simulate a sumo squat quite efficiently. But as you can see, depth in this movement is being achieved through lordosis. Here is a summary of what we've got Rebecca doing moving forwards.